Next up is Manu Beerens, who is an instructor at Brigham and Women's Hospital and has built a pipeline for precision medicine, moving from people to fish.
Hi there. First of all, I want to thank the organizing committee for inviting me. It's a great pleasure to be here, talking about a Zebrafish pipeline for cardiovascular precision medicine. Now, we're all gonna hear the word cardiomyopathy a lot of times today, but basically this is one of the most heterogeneous group of disorders known to mankind. And clinicians often meet patients that present with hypertrophic cardiomyopathy, restrictive cardiomyopathy, left ventricular lung compaction cardiomyopathy, and dilated cardiomyopathy. And actually these all have very distinct phenotypes, and even with the newest imaging techniques, it is hard for clinicians sometimes to stratify these patients. Now, throughout the last couple of decades, a variety of mutations have been found to be associated and linked with these types of cardiomyopathy. Now, intriguingly though, several of these mutations can lead to multiple types of cardiomyopathy with very distinct phenotypes, meaning that the absence or presence of modifier genes or the exact type of mutation that is induced in these proteins can cause very distinct effects, and that adds another dimension to the heterogeneity of these cardiac disorders. Now, despite this enormous diversity in phenotypes, the current FDA-approved drugs to treat cardiomyopathy can all be basically classified as ACE inhibitors, angiotensin II receptor blockers, your typical diuretics, your beta blockers, but also your renin-angiotensin modifiers. Now, these are all based on very generalized principle. Their mechanism of action is, besides keeping your potassium in check, is to reduce heart rate, lower blood pressure, and thereby reduce the burden on your heart, making it work less hard. Now, and I think there is a worldwide consensus that if we were to be able to design and develop new drugs that actually take into account the specific etiology of all these subgroups of cardiomyopathy, we might come up with better, more effective drugs that are tailor-made to the disease. Now, in order to do that, to design these novel drugs, you need a model. A model that is, you can edit the genome rapidly, and I think the Zebrafish, together with the CRISPR-Cas9 technology, allows you to do this. It should have a rapid turnover, meaning it should develop rapidly, but also you should be able to get your results through your pipeline very rapidly. And I think this is an image of a fish that is just 2 days old and already has a perfectly functioning heart with a clear distinction between the ventricle and the atrium right here. Fish are also very cost effective. I mean, you can house up to 20 fish in just one single tank of a couple of liters, say a gallon of water. Now, a perfect model also has to have quantitative endpoints. Now, in our lab, we realized several years ago that, like in human cardiomyopathies, the BMP levels actually rise also in a lot of zebrafish mutations that present with cardiomyopathy. And this is just one example demonstrating that in Titin mutants in the fish, there are elevated levels of BMP compared to the heterozygous or wild-type siblings. And so what we did is build actually a lot of mutants in the fish on this BMP. We built a BMP reporter line and then outbred this line on several mutations. So we now have a quantitative endpoint. But I think the real strength of the zebrafish lies in its representative physiology. If you look at the action potential curve of a murine or a human ventricular cardiomyocyte, they look nothing alike. However, the action potential curve of the fish and the action potential curve of a cardiomyocyte of the human are practically overlays, meaning that the physiology in the heart is far better conserved going from fish to man than from mice to man. And I think that's why the fish is such an exquisite model to start screening for these more specialized drugs I was talking about just a minute ago. Now, the fish also obviously allows you to perform high throughput screening, and that's exactly what we did. We array typically up to 5 embryos per well in a 96 well array format. And you can see here these videos here using high resolution imaging. We can nicely track the cardiac contractility and the flow going through the vessels of these fish. Now combine that with crossing out our mutants on the BMP reporter background, we now can screen 96 compounds, and we can typically screen a couple of hundreds or 1,000 a week actually in any model you want with these endpoints right here. Cardiac contractility, BMP levels, heart rate, and tail flow. Now it's all nice that we've built this model, but does it actually work? And the answer is, it does. Together with the lab of Jeff Savitz at the BI, we built a model for arrhythmogenic right ventricular cardiomyopathy associated with nexus disease. And I think you can all appreciate that these fish have highly hypertrophic ventricle compared to the wild-type fish here. Now, using this high throughput screening method, we identified a compound which is termed SB2 that not only rescues this ventricular hypertrophy, but also has a positive impact on the survival of these fish. And this coincided with reduced levels of that BMP reporter I was just talking about. Now, what is nice about this is that when you put this compound in higher organisms, in mice and man, it still works. And this is just a model for ARVC in the mice here, showing again that there is a severe reduction in ejection fraction when mice are treated with vehicle in nexus mice compared to wild-type mice, but that this reduction in ejection fraction is almost completely rescued when you treat these mice with your SB2 compound. Moreover, nexus disease is highly associated with defective junctions between the cardiomyocytes, and people have typically used connexin 43 to demonstrate this. When you look at iPS-derived cardiomyocytes that have ARVC, that are derived from an ARVC patient, or where you introduce an ARVC mutation, you actually see that there is no clear boundaries and you have lost your organized connexin 43 staining pattern. However, this is also rescued with the SB2 compound, meaning that the SB2 compound that we originally identified in a very small basic organism, meaning the zebrafish, also still holds true in higher organisms. And so I think we're continuously looking for industrial partners that want to embark on us on projects where they want to screen annotated or non-annotated compound libraries. And these are just some of the cardiomyopathy models we have at our disposal in our lab, and obviously we're continuously expanding the list. But I don't want to just stop talking about cardiomyopathies, because this very same technique, high-resolution imaging in the fish, combined with metamorph software analysis to get your automated phenotype-driven screen outputs, you can also apply not only for cardiomyopathy and heart failure, but also for arrhythmias, atherosclerotic lesions, and some diseases associated with metabolic syndrome. And we actually do have also these models available in our lab. Now, we have programs at multiple stages right now. And again, we're looking for industrial partners to push these through till the final endpoint. We're continuously exploring the disease mechanisms. Once you've identified a hit, you can then deconvolute its targets and actually learn a lot about the molecular mechanisms driving these diseases. And obviously, we're hoping that we can be a catalyst between industry, scientists, and clinicians of actually pushing these originally identified hits to true therapeutic leads that are leading the field in cardiovascular science. And furthermore, this is my last couple sentences, is that this is a perfect example for precision medicine in cardiovascular science, where you can stratify the disease and come up with mechanism-specific interventions that have a higher therapeutic value than the more common generalized drugs that we are using today. And I would like to thank you all for your attention.